chiropractor and a functional medicine doc here. I got into doing this work actually because Dr. Turnpaugh himself helped my mom almost 20 years ago with her thyroid. So thyroids and holistic help for thyroids have been a sort of near and dear thing to my, not to me personally, but to my dear mother. Dr. Turnpaugh's help with her thyroid inspired me to get into doing functional medicine. And here I am 18 years later, and I'm actually able to be part of the practice here and continuing helping other people. So tonight I'm going to talk a little bit about how we help people with thyroid issues in a more complete, maybe holistic, it might be a word, kind of fashion than what we might encounter in sort of the standard medical practice. So I'm going to kind of go through this. I'm going to try and leave plenty of time for questions later too. So you're always welcome, especially if you have personal questions, to take me aside, ask me stuff. You don't have to like tell everybody your personal information in front of this group if you have some more specific questions. So we'll go ahead and start. We're going to start talking a little bit about what is this thyroid thing. What does it do? All right, your thyroid is a butterfly-shaped gland right here on the front part of your throat. It's in this illustration right up here. And the cool thing about your thyroid is that it makes thyroid hormone. Every cell in your body has a receptor for thyroid hormone. Literally every cell. So it affects everything, literally in your body. Thyroid hormone goes into the cell, and it actually can affect how fast DNA is read. And DNA is what codes for all the metabolic machinery, the enzymes that do all the work of your cells. So when we have adequate amounts of thyroid hormone going in, transcribing that DNA, making those proteins, metabolism happens, and it happens at the rate that we would like it to happen. When we don't have enough thyroid hormone, none of that happens very well. Everything kind of gets kind of slows down. All right? So we're usually talking about thyroid symptoms in terms of a hypothyroid or a hyperthyroid, okay? So a hypothyroid is usually an underactive thyroid. There's not enough thyroid hormone that's getting into the cell and affecting how fast that DNA is being transcribed and how fast those enzymes are being made. So things that commonly happen, weight gain or weight loss resistance. I just can't get this last 10 pounds off. I've done everything, all right? There's a bunch of other things that happen there. It's not always a thyroid, but that's one of the symptoms. Fatigue. I'm so tired. I just can't get myself out of bed. I nap. I wake up and I'm tired, and I've been in bed for 8 hours. I just like can't do the same things that I used to do. Everything's a struggle. You know, that kind of fatigue. Brain fog. Some of my patients with a hypothyroid will tell me like my brain feels like I'm trying to just think through mud. I know things are happening, but I really just can't get clarity. Nothing feels like it wants to actually work properly. For some people, it may show up as depression, okay? Cold hands, cold feet, okay? If I'm not getting enough thyroid hormone into these small little cells at the ends of my extremities, it's hard for them to make the energy that they need to stay warm, especially if it's colder outside, okay? So your person who's like, I need a sweatshirt, and it's 90 degrees outside, we might need to check their thyroid, right? Know any of those people lately? Chronic constipation, okay? In that case, the cells that line the gut are not getting input from thyroid hormone that they need, so everything in the bowel slows down, and we have a harder time getting bowel movements passed. We might just have a slower, what we call a transit time, okay? Is anybody familiar with that concept? Transit time. If you eat corn on the cob, if it takes like 2 or 3 days before you see the corn on the cob again, you probably have a slower transit time. Hair loss is another big sign of a hypothyroid. Okay, it can happen from anywhere on the head, but we'll say in particular the lateral third of the eyebrow, usually because your eyebrow tail is kind of more narrow and not very thick to begin with. So if we start losing the tails of our eyebrows, that can be a sign of a hypothyroid. The hair follicles, the cells that grow your hair strands, very metabolically active. They need all kinds of stimulation. They need all kinds of nutrients in order to be able to grow and hold on to hair. So they're very sensitive to a lack of thyroid hormone. They can be very sensitive to nutrients being depleted. They can be very sensitive to stress. So like women who just had a baby, or people who have like long COVID sometimes will have their hair all fall out because those hair follicles are really sensitive to some of that stimuli and the environment not being just right for them. Come on in. All right, hyperactive. That's the opposite. Hopefully that was clear. All right, but a hyperactive thyroid is going to have most of the opposite kind of symptoms. Usually that person will be smaller. They might have trouble gaining weight. It feels like everything just kind of runs through them. They might have slightly looser bowels. Heart palpitations can be a sign that some people will find very disturbing. Okay, so sometimes my folks come in and they've had a whole cardiac workup and they've done Holter monitors and their heart's okay. Another thing I'll say, hey, maybe we should check out your thyroid and see what it's doing. That it might be causing some of these palpitations. Okay, anxiety, because if you've got all this thyroid hormone running and making your neurons fire really fast, we might get this sort of anxious feeling because we can't put the brakes on certain sort of loops in our brain. And I put in here bulging eyes. We technically call it exophthalmos, is it? But when you can see the white part of the eye over the pupil and under the pupil, the muscles that hold the eye in place get so much thyroid hormone, they get so tight, they squeeze back and almost kind of push the eyeballs forward a little bit, okay? So you might see a picture of that a little bit later when we get more into hyperthyroids. So that's how it presents. Here's the boring part where I'm going to talk a little bit about the physiology so you can understand some of the other stuff later. I promise I will try and make this as easy and digestible as possible, all right? So the thyroid doesn't work alone, all right? It's not a lone wolf here just sitting in your neck deciding like what to do and when to do it, okay? It's getting its orders from your master gland in your brain called the hypothalamus, okay? And its buddy, the pituitary. These three together make up what we call the HPT axis, or the hypothalamic pituitary thyroid axis. That's why we call it HPT for short, because it rolls off the tongue a whole lot easier. The hypothalamus is your master gland up in your brain, and it's constantly sensing kind of what's going on. It's like your body's thermostat, and it's getting blood flow from the rest of the body, and it's kind of sensing how much of these hormones do we have. What's the temperature going on? Do we have inflammation happening? And then it's using the pituitary right in front of it to make sort of the things happen that need to regulate what's going on, okay? So the hypothalamus, when it senses the levels of T4, that's thyroid hormone, it will then tell the pituitary gland how much TSH to make, or thyroid stimulating hormone, okay? And this back and forth helps maintain what we call homeostasis in the body, okay? So we're constantly using this sort of seesaw. Did I go past it? How did I go back? There we go, TSH. Right here in the center, this little stalk here is where that pituitary lives. It's sort of a little thing that hangs down there in the center of your brain. In addition to TSH, it does other things like follicle-stimulating hormone, LH, luteinizing hormone, a bunch of other things. That's a different talk for a different day. But that hypothalamus is sensing how much T4 is in the system and then making a call about how much TSH to lever on to bring the T4 levels into the level we want. Okay, so just remember, if you take one thing away, they're a seesaw, or they should be. Okay. So the most common condition I would say we work with here is hypothyroidism. All right, so I'm going to kind of focus a little bit more on the hypo situation than the hyper situation this evening, because hypothyroidism is incredibly common. So levothyroxine, or Synthroid is the brand name of that, is the third most prescribed drug in the United States. Okay, the last time I checked, it was the third. Okay, it's behind a statin and I think Prozac, fluoxetine, and then levothyroxine. So there's a lot of people who are walking around with thyroids that aren't working right. the most common reason for thyroid's not working is iodine deficiency. Right? And sometimes people get goiters and they'll get swellings that happen on their thyroid because they are deficient in iodine. Here in the US, however, the most common reason for hypothyroid is actually an autoimmune condition called Hashimoto's autoimmune thyroid. And I see some nods in the head. Or in the audience, people they know what I'm talking about. Okay. So Hashimoto's is an autoimmune condition to the thyroid. All right, so that means we're technically not talking about a primary thyroid problem. The thyroid is doing its job okay. It's getting input from the brain in the form of TSH. It's making T4, T3, which is what its job is to make, okay? What's happening in Hashimoto's is that the immune system is now thinking that the thyroid gland is a foreign invader and is basically mounting an immune attack to it. That's the definition of autoimmunity. When our own immune system looks at cells in our own body and says, you don't belong here, I need to get rid of you. Okay? That's a big problem because our immune system should be seeing and reading our own cells as us and leaving those alone. Okay? So Hashimoto's is the most common autoimmune condition to the thyroid gland. This is a picture up here of that exophthalmos bulging eyes. That tends to happen in Graves' disease, which is the opposite. That's an autoimmune disease that leads to a hyperthyroid. Okay? Autoimmunity can often have a genetic component. I mentioned earlier, my mom has a Hashimoto's, right? So I'm always doing my labs and checking and waiting for the day that mine pops up. It hasn't yet, but it could, because I probably have a genetic propensity somewhere hiding in my genome, okay? And the thing that can set the stage for that is inflammation. And we're gonna get into that a little bit more, because that's how we address the thyroid, and especially a hypothyroid, in a much more like holistic and complete way than what is sort of just standard of care medicine, okay? So this Hashimoto's autoimmune thyroid thing, over here on the side, just a bunch of cool like kind of gobbledygooks, be like, there is real science here that I'm talking about, okay? There's tyrosine, which makes the T in T4, okay? And we put iodine molecules onto that. T4 is just the tyrosine thyroglobulin complex with 4 iodine molecules. T3 is the thyroxine thyroglobulin complex with 3 iodines on it, okay? Roughly 85% of what the thyroid makes is T4. About 15% is T3. T3 is the actual active hormone that actually goes in and interacts with the cell. So we need T4 at some point to lose an iodine molecule and become T3 in order to actually have activity. Something to remember for a little bit when we get into talking about testing. Okay? In Hashimoto's, the main target of the immune system is this, what's called thyroid peroxidase enzyme, and that is the enzyme that takes the iodines and sticks them onto the thyroxine. Okay? That's important because one of the things that people will often say for a hypothyroid is, oh, take iodine, have more seaweed, eat kelp, okay? But if you have Hashimoto's and your immune system is already reacting to the thyroid peroxidase enzyme that is putting iodine molecules onto thyroxine, and you add some more iodine in there, you potentially drive the immune system to go after that and create more inflammation in the thyroid gland. So that's not always a really great idea to just throw some iodine in there and see if my thyroid function comes up, okay? So the TPO, that's what I call TPO, thyroid peroxidase enzyme TPO for short, because I talk about it all the time. Okay, so TPO is the target of the thyroid cells. The thyroglobulin, that's part of the complex to the tyrosine, is also often a target of the immune system. So sometimes I will see people have just TPO antibodies. Sometimes I'll see them have just thyroglobulin antibodies. And sometimes I'll see them have both. Okay. This is salient and this is relative here because these antibodies can show up to the thyroid years before your thyroid function actually tanks. Okay? So I see it very commonly because I'm always looking at this on patients' blood work. I can tell you so many times when I've seen a woman in her 20s or 30s who has no overt signs of hypothyroid. She might just be a little bit tired and a little bit sluggish, and maybe she has a little bit of brain fog, but that could be a bunch of different things. I test her thyroid to rule out that thyroid is the problem, and TSH, T4, and T3 are all fine, but she has antibodies to her thyroid. Okay? That thyroid is still working okay for now. But that woman is often going to be the person who, in her 40s, now has to go on thyroid medication because 10 to 20 years of her immune system beating up and destroying her thyroid gland has left less thyroid tissue to make T4 and T3. Now we have an overt thyroid issue because T4 has dropped and TSH has had to elevate to compensate or to try and stimulate the thyroid gland to make more T4. Okay? At that point, she gets put on medication, the levothyroxine, and depending on how much tissue destruction has happened, we may not be able to get her off again. Okay? If I had met her and tested her thyroid antibodies 10, 20 years ago, I could have said, let's cut off the gluten now because gluten drives TPO antibodies and will save your thyroid gland from being destroyed by your immune system. So hopefully down the road, you don't have to be on medication for the rest of your life to compensate for your thyroid gland. Okay? The other thing that's important to know here too is that when the immune system is attacking this thyroid gland, during the actual active attack, T4, T3 gets dumped into the blood, and we can actually have hyper symptoms for a time. So with Hashimoto's, it's very possible to get hyper and hypo symptoms, okay? So I don't need somebody to have Graves' disease to be having heart palpitations driven by their thyroid, okay? They could still have an elevated TSH. If they have autoimmunity to the thyroid and they're attacking it, we can still get some of those hyper symptoms when we're having an actual active attack on the thyroid gland. Just a little word about Graves' disease, the hyper version of it, so that's different antibodies. Those ones attack the TSH receptor. When they do, they spill all this T4, T3 into the blood because an overactive kind of scenario. It's not unsimilar to what we were just talking about with the potential for Hashimoto's antibodies. Graves just tends to do it at a much higher level. Sometimes we have to escalate how we manage this in order to really get that autoimmunity to come down so we're not having the whole system revved too high. So let's talk about how people get diagnosed and how hypothyroid often gets missed, okay? One of the big things is that TSH is the only test that we use, all right? I was just talking about with Hashimoto's. If we wait till her TSH is going up and she has Hashimoto's, we may have already lost a certain amount of tissue before we actually see the brain respond to the lack of tissue. Does that make sense? All right. The TSH range on a standard blood test is also huge. All right. The lab that we use here, LabCorp, they do 0.45 to 4.5 international units per milliliter. Okay. The American Academy of Endocrinologists say that a normal range, a normal physiologic range, is probably more like 1.5 to 2.5 or 3. So you can see that that's much smaller on the inside of this range, okay? Something to keep in mind is that TSH, that range, is not based on a physiologic number. That's not a, hey, you don't have symptoms or disease if you're in that number. What that range means is that we took an average of all the people who have their TSH tested within a certain time frame, and we made a bell curve, and we went out 2 standard deviations, and then we cut it on this end and this end, and that's how we came up with that range right there. So if you feel like you have hypothyroid symptoms, and you go to your doc, and he's like, oh, well, your TSH is normal, okay? What that really means, if they're using this range, is that you're normal compared to all these other people who have thyroid disease. All right, you're not as sick as this 10%, you're not as sick as this 10%, but you absolutely could still be having hypothyroid symptoms with a normal TSH number. Okay? And then, like, how are you supposed to advocate for yourself to this doctor who's like not going to help you because your TSH is normal? Okay? The other problem that leads to a lot of hypothyroidism being misdiagnosed is that TSH is the only thing that gets measured, okay? So I was saying before, if we're not looking at antibodies, if we're not looking at the T4 numbers, if we're not looking at the T3 numbers, we can still have symptoms of a hypothyroid with TSH being normal. Because remember, TSH is the brain hormone. So as long as the brain is up there like, everything's fine down here, stuff could be happening down here that the brain's not aware of, and we don't see it if we don't actually test those numbers, okay? And antibodies are rarely, if ever, measured. I'm usually one of the first people that manages or measures antibodies on a lot of people who walk into my office for hypothyroid symptoms. I've had patients in the past who I'm like, you know, you have Hashimoto's, right? And they're on Synthroid. They've been on Synthroid for years. And they're like, oh, no, I never knew that. And they go back and they talk to their like prescribing doctor about, you know, how come you never tested my antibodies when you've been prescribing me Synthroid for all these years? And the docs are like, well, all I was going to do was prescribe you more Synthroid, so why do I need to look at your antibodies, okay? Meanwhile, they've missed that we can do a lot to support that person with diet, with supplements to help keep the thyroid working as much as possible. The Synthroid just replaces the T4 that the thyroid gland can't make anymore. It does nothing about the immune system issue that's happening, all right? I keep saying she when I was talking about my theoretical person that comes in because thyroid and hypothyroid is much more prevalent among women, and especially Hashimoto's, because women are more likely to have autoimmune diseases than men. About 1 in 4 women will have an autoimmune disease compared to 1 in 5 men. There's something about estrogen that just makes our immune systems a little bit more wackadoo, all right? It also doesn't help that we have major transitions and shifts in our hormone physiology that can annoy our immune system, okay? So one big trigger can be pregnancy. When we go through a pregnancy, we actually have to have a shift that happens in our immune system. So at a certain point, our immune system doesn't think the baby, who is foreign tissue, it's not our tissue, it's now a whole separate thing. We don't want our immune system going after this thing, thinking it doesn't belong there, and it's a foreign invader, it needs to be attacked. So we actually have a natural flip-flop that happens in our immune system, depending on which trimester you're in, that allows that to happen without an immune interference from our own bodies, okay? It flip-flops back in the 3rd trimester and postpartum, and then there's a point where we should come back to our normal balance in the immune system. Along the way, though, this autoimmunity can get triggered. It's actually called postpartum thyroiditis, and it happens to some women. I'm the reason why my mom got Hashimoto's. She gave birth to me, and then she had thyroid issues after that, went on thyroid hormone, and has like never been able to get off thyroid hormone ever since, because the hormones that shifted in pregnancy. So there is things about our hormones that make the thyroid and make us more susceptible to thyroid issues. Perimenopause is another transition point with our hormone shifts for women, that it is a natural stage of life, but can also bring out, if you're in your 40s, you probably know a bucket load of people who are like suddenly on thyroid medication because they're in their 40s now too. It's like perimenopause and thyroid seem to just go hand in hand, okay? Thyroid hormone is really important to be checked in pregnancy. Baby gets all their thyroid hormone from us initially. They need it, again, every cell in the body needs thyroid hormone. And baby is initially going to get thyroid hormone from our bodies during development, so they need it for their brain development, for all their cells to be working properly and at the right rate through the growth of the baby. So let's talk about a little bit of some natural ways to help support a thyroid if we're having a thyroid issue. I tell people all the time, if you do suspect that you have an issue with your thyroid, the biggest and first thing you can do is get a complete thyroid panel, okay? Not just TSH. Get a complete thyroid panel. We do them here. Just tip there. Some people, if you don't have access, I'm saying also for people who may be watching online, there are ways that people can get testing that they order themselves through like Any Lab Test Now or something like that. You know, if you're doing that for yourself, make sure you're ordering the full thing, okay? If you have antibodies, a huge thing, if you know you have antibodies, you need to avoid gluten. The science is pretty clear. Gluten, when the body digests it, looks a whole lot like that TPO enzyme. And so the antibody that the immune system makes to gluten can go and bind to that TPO enzyme and lead to the immune system attacking the thyroid gland. So when someone comes into my office, they haven't had their thyroid antibodies tested before, I find thyroid antibodies and I'm like, well, you and gluten are breaking up now. There's sometimes tears and screaming and crying and gnashing of teeth. Some people already know that ahead of time, but it's the biggest thing I can get someone to do to help preserve their thyroid gland, okay? Because all the natural supports and supplements that I can give them, if they're still stimulating their immune system to go attack their thyroid gland, eventually they're going to lose tissue and need to have replacement hormone to make up for the lack of hormone that the thyroid gland can't make anymore. All right. Along with that, I will say, if we have leaky gut and gut inflammation, that can also be driving some of that autoimmunity to the thyroid gland because of cross-reactivity. So I often will also recommend that people use natural supports like selenium, okay, NAC or N-acetylcysteine, or glutathione that will help protect the thyroid gland from attack, okay? It doesn't stop the immune system from going after it. We still need to do some of that cleanup work, but when the immune system does go after the thyroid, this helps clean up some of the free radical damage that can happen and start to damage neighboring cells, okay? Selenium and NAC are basically cofactors for glutathione. Glutathione is the body's main antioxidant. We call it the body's bodyguard around here. So its main job is to just absorb free radical damage for us. Glutathione as a supplement is expensive. It's hard to get past your digestion. So we use things like NAC and selenium to help your body make more glutathione to increase that antioxidant function, right? Kelp and seaweeds for iodine. I already said my piece about that. You should make sure you don't have any autoimmunity to your thyroid before using that. But in some places, like I said, in other places in the world, where Hashimoto's is not the main reason for hypothyroidism, where iodine deficiency is a big issue. If there's like a big goiter or something like that, it may be an iodine deficiency, and kelp seaweeds that have their high in iodine may be useful in that situation. Ashwagandha, bacopa, gum google. These are a couple of Ayurvedic herbs that I use a lot to help support people's thyroid glands. Ashwagandha, bacopa, gum google, all of them can also help with the conversion of T4 to T3, right? So that is one of the things that is often assumed when you have your blood work done, that the T4 to T3 conversion happens at a fixed rate. And I'm here to tell you from all the blood work that I look at, it is not. There's different reasons. If there's inflammation, you might have plenty of T4 and it doesn't get converted to T3 properly. And then you have great levels of T4, but you still have none of the actual active hormone that you need to go and interact with the cells. So TSH might be normal, T4 might be normal, T3 is low, you still have hypothyroid symptoms even though TSH and T4 are normal. So we use some of these botanicals to help with that conversion of T4 to the T3. And then just something to note, if you eat a lot of mint plants, particularly lemon balm, motherwort, if you're doing a lot of like self-herbalism or something like that at home, those actually can interfere with some of the conversion of T4 to T3. Lemon balm, motherwort, holy basil are the main ones that are there. Seeking assistance. So, like I was saying before, a lot of times when people suspect that they might have a hypothyroid or a hyperthyroid, they're going to their doc to get a workup and they're getting just a TSH test. And I think we've belabored why that's maybe inadequate. So, little shameless plug here. We do all of these. So this up here is what is a complete thyroid panel in my book. TSH. TT4 is total T4. FT4 is free T4. TT3 is total T3. And FT3 is free T3. Then there's reverse T3 and T3 uptake. I could talk about those for another half hour and just bore you all to tears. But the total and free T4, all of the thyroid hormone that your body makes, some of it is available, some of it is bound to hormones as it rises in the blood. The free is what is open and available and not bound to hormone. The total is the fraction that is both. That includes what's free and what's bound to hormone. Reverse T3 is a mirror image of T3 that doesn't do anything. But when it's elevated, it can indicate that there is inflammation. And so it's like useless T3. Instead of making the T3 that we need, we make too much of the reverse or the mirror image, and it doesn't work. It's junk. T3 uptake is a measure that we can use to see how much T3 cells are actually uptaking. That's like the easiest one because it says what it does. Okay. The advantage of working with like a holistic practitioner as opposed to a regular doctor is the understanding of autoimmunity and how it contributes to dealing with your thyroid, supporting your thyroid over time. We here specialize in natural supports for thyroid, but one of the advantages at our clinic, we have an integrated clinic, so we also have nurse practitioners and PAs on staff that we can work with if we do need medications when those are warranted with someone. And we also have nutritionists here on staff. So when I ask somebody like, hey, you need to go gluten-free if you want to protect your thyroid gland from being destroyed by this gluten that you're eating, and you go, what am I going to eat now? I say, I think you need to talk to the nutritionist, and she'll help step you through this whole process of making the transition to gluten-free, make it a little bit easier, make it a little bit simpler so it sticks a little bit longer for people. Right. That is my spiel about thyroids, because I want to leave more time for like questions that people might have about thyroids. Anybody have a question that they'd like to say in front of people? Like I said earlier, you're welcome to talk to me along the way, side by side, like a side conversation if you have some personal question that you don't want to say in front of people. Last